Hello, I'm Dr. Martin Dawes, and in this short video I will show you how I use TreatGx to identify medications for patients with hypertension. First of all, I'll log into the system, select a patient, and then select hypertension. In this you can see that the patient has diabetes 71, some genetic results which we'll get to later, some mild kidney damage, and these are the drugs they're taking. So I'm going to create the personalised options for this patient straight away by selecting the blue button. The algorithms have now identified a lot of drugs, and at the top you can see ACE inhibitors, ARBs, calcium channel blockers or thiazides, and that the patient is at increased risk of ACE cough due to the variant, and that variant is over here. If we go down to the diuretics and get to hydrochlorothiazide, you'll see that with the variant for RS4961, you're likely to have an increased response. So let's say that I add hydrochlorothiazide as my first line therapy. So I select the drug here, and I can see which are the options available to me next. And you can see up at the top we've got ACE inhibitors, angiotensin receptor blockers or calcium channel blockers. But the system is dynamic. Let's say this patient actually, we get the result back showing that they've got a systolic heart failure with an ejection fraction. You can see immediately that the calcium channel blockers are now not identified as options for therapy at this stage. So I will start the patient on an ARB or an ACE. Now let's assume that I've started an ACE, but in fact that they've got a cough. So I can actually enter that in the disease-specific area. So previous trial of ACE inhibitor. And you can see now that the list is getting shorter. So let's try the patient on candesartan. I update. So now I'm getting beta blockers as my next level, and you can see here metoprolol is not included as an option, again because of a genetic variant. So I'm going to try the patient on bisoprolol. The patient's now on bisoprolol, candesartan, hydrochlorothiazide. And here are the drugs that are now left over to you. And let's say that the patient's renal function is actually more impaired. And you can see that again the list is affected. So this is how it works. I suggest that you try the system with one patient per clinic to become familiar with it. And if you have any suggestions for improvement, please email me